Hello, everyone. My name is Kayshara Gibbons, and I decided to do my functional therapy on identifying and organizing medication. The target of this activity is to be functional and patient specific using the Montessori intervention and caregiving training. The activity is to properly identify and organize medication. It may be used for individual therapy that includes caregiving participation. It is designed for patients on the GDS levels of 2 to 3 in rehabilitation, preparing to be discharged from assisted living facilities to independent living. So, for example, this medication will train and assist the patient in identifying which medication should be taken in morning or which medication should be taken at night. And it will also form a way of communication between the caregiver and the patient. The goal of this activity is that the patient will follow steps in identifying and organizing daily medications. The skill note that I wrote to go with this activity is the SLP instructed patient and caregiver in Montessori functional activity to improve the patient's skills in identifying and organizing medication upon returning to independent living, given verbal and visual cues, performing with 80% accuracy in 4 out of 5 attempts over 3 consecutive sessions. The materials that are used with this activity are the medications of the patient. So you would ask the patient or caregiver to gather all of their current medications that they take daily. A pill organizer. So you may ask the caregiver to find the best pill organizer that has the capacity of the patient's current medications. So some pill organizers may come for a full day, meaning like morning, noon, or night, or they may come in just a single day or a single week rather. And then they also may come in, for example, like this one shown, in two, as in one pill medications in morning and the other at night. Also, you may need markers or stickers. So basically, you will instruct the caregiver to color coordinate the medications of the patient for visual cueing. So if the current tray that they have to put their morning meds in, if that's green, then you will put a green sticker or green marker on that medication. Or if it's at night, then you will put a blue dot or a blue sticker on that medication bottle. The steps that you will ask the patient to take are the following. First, you will ask the patient to read the label on the medication bottles. Then ask the patient to identify the time of day the medicine should be taken, determining from what he or she read on the label. After identifying the time of day, ask the patient to organize or place the pill in the correct box of the day and the time of day with the designated color that it should match. So again, if it's green for morning, then you will be sure to coordinate, okay, green goes with morning. And then if it's blue, you will coordinate, okay, blue for night. Here is an example of a mock therapy of how this activity may be conducted during therapy.
Oh,
Okay, Mr. Gibbons, so today we're going to work on sorting your medicine, okay? So, all right. Do you see what color is the night medicine? PM is for what? What is PM for?
Night.
Night, right. So it will be blue. AM is for morning. So your morning meds are going in the green part. So Miss Gibbons, what will probably help also is when his medicine comes in from the pharmacy, if you can probably color coordinate it with these. So sometimes that will help. It'll be something like a picture he can look at. Okay, blue, night. Green, morning. Okay? All right, Mr. Gibbons. So what I want you to do is I want you to read each prescription and tell me which one. Is it for night or is it for morning?
Let's take one tablet every 4 hours.
Okay, so you would take one night and morning. So you can put one in each. Okay? All right. What does this one say? Night or morning?
Take one tablet by bedtime.
Bedtime. So what color is that?
That's blue. That's
Blue. It'll be blue. Good job. All right. So what about this one?
Take a half tablet Once a day.
Once daily. So we can do that in the
Morning.
Good job. So we're going to put that one for green. And we got our last one. This is one of your vitamins. Do you take this in the morning or night?
In the morning.
In the morning. So that color will go with, what color is it?
Green.
Green. Good job. Some modifications that may be done within this activity if the patient is nonverbal or have difficulties with verbal communication, along with decreased motor skills. Demonstrate different gestural communication variations at the patient's level of communication for patient and caregiver to properly organize medication. This may be a way for you to instruct the caregiver on how to understand the patient, or for the patient to convey something that they are trying to communicate to their caregiver about their medication. Also, you may add space retrieval training, which may be increased or decreased judging upon the patient's functioning level. So that is all for my functional activity. I hope you guys enjoy it, and I hope that it's helpful for you in your future endeavors.